Welcome once again to another edition of Ask the Doctor. I'm Wale Okedino, a medical doctor, family health physician of 45 years in practice. As usual, we are going to go through 8 questions sent in by my patients so that we can understand some of the common medical issues around us. The first question is from somebody who wants to know whether there's any benefit for intermittent fasting. Say, I want to comment on intermittent fasting. Can you let me know if it has any health benefits? And my answer is that fasting or restricting your intake of solid foods is often promoted as a means of losing weight. Studies have also suggested that intermittent fasting, that is, when you fast alternate days, that is, a reduction in food intake, may have several health benefits. Fasting has not been part of many traditions and religions, but it's only in recent years that the health benefits of fasting have been investigated. Most recently, many studies have cited the effects of intermittent fasting, and it has been confirmed that it may help to lose weight, to reduce the risk of diabetes. It will also improve heart and brain health, and then lower risk of cancer. It can also reduce inflammation, and it can also add to longevity. So these are some of the positive effects. However, it has also been confirmed that for those people who have peptic ulcer, that is stomach ulcer, fasting should not be encouraged because it can worsen that ulcer. Then the next question is from somebody who says he's a gentleman. He says, I'm having some problems with my erection. Can you let me know if it is safe for me to use some of the common drugs on sale for the treatment of erection problems? That is, his penis doesn't stand up well for how to have normal sex, and that is his complaint. So my answer is that, yes, it is true that some drugs can be used to treat erection problems. However, it is important for you to check a few things in your body before you use these drugs. It's better to see a doctor or a nurse who will check your blood pressure to make sure you're not hypertensive, because usually when you use these drugs for erection problems, it can raise your blood pressure. Then it's also nice not to use these drugs with alcohol, because it will also heighten the effect of the drugs on the body. And then you also need to know whether your blood sugar will be checked to find out whether you are diabetic, and also know whether you are using other drugs. So you don't need to. It's not good to use sex stimulants with some other drugs like Indian hemp and all those drugs, hard drugs. Using sex stimulants without knowing your health condition can lead to some avoidable complications. So it's important to do this before you use it. Then, secondly, this is also about fatting, another problem of gassing. He said, I noticed that anytime I eat beans, any meal prepared with beans, I always fat, and I love eating beans a lot. What can I do? So he passes gas a lot after eating beans. And my answer is that flatulence is a normal process that can occur to you, and it is caused particularly when after eating beans, because it has been confirmed that there are some chemicals in the beans that creates a lot of gas in the stomach. Therefore, when you eat foods like beans, cabbage, and lentils, they all contain this gas-producing chemical. Therefore, the way to do it is to minimize your consumption of beans. Some people also find that when you soak these beans before you cook them, it can reduce your production of fat. In other ways, some people know that they like to cook the beans with something else. Maybe they can cook the beans with rice, or with plantain, or with gari. When they combine these things, they say that it reduces the production of gas. And then, after eating beans, it's always nice to drink plenty of water so as to reduce the gas production. The fourth question is this. This man, he said, I'm a healthy 65-year-old man with a pot belly. Despite cutting down on my consumption of starchy foods and alcohol, my belly has not diminished in size. Some of my friends have informed me that this is middle-age spread and that there's nothing I can do about it. I want to know if this is true. And my answer is that even though middle-age spread can be responsible for your pot belly, dieting through reduction of your intake of starchy foods as well as reduction of alcohol have been discovered to help in reducing the abdominal fat. Also, occasional fasting can help you in reducing your fat. In addition, exercises that increase the heart rate and make you sweat will help you to lose some weight, including the one in your abdomen. In exchange for the reduction in your intake of starchy foods, you will need to increase your intake of fruits, fresh fruits and vegetables and other cereals. And as I said, it's always nice to go for exercises, whether simple walking or going to the gym. The next question, that's the fifth question, is from a 75-year-old man. He said, I'm a 75-year-old man. I want to know if I can still be eating eggs at my age. And my answer is very straightforward. Yes, egg eating is very good, even at an advanced age, because due to the variety of nutrients found in the eggs, they are an ideal food to include in the diets of older adults. They are also very cheap to buy, they are economical, they are easily prepared, and soft in texture, which make it easy and appropriate for people of your age group. Therefore, 1 or 2 eggs a day is still good for your age group. The next question, that's the sixth question. It says, you want to know about coffee. You want to be drinking coffee. I say, I want to know if regular consumption of coffee is good for my health. I'm a 60-year-old man and I'm in good health. So my answer is this. That scientists have found that a chronic intake of over 400 milligrams of caffeine, that is about 4 cups of coffee every day or more a day, may lead to some health concerns, including anxiety and insomnia. And it's not only coffee. It is also when you drink these energy drinks or a lot of carbonated drinks, you can also have health issues. In those who chronically consume 600 milligrams of caffeine a day, that is, which is higher than the recommended portion, scientists have confirmed elevated heart rate and elevated blood pressure. This indicates that habitual high caffeine intake might hinder the recovery of heart rate and blood pressure if you persist in them. Therefore, the advice is that 1 or 2 cups of coffee a day is enough, is good. But when you exceed about 4 cups every day, then you may have some problems. So that is why it's good to limit your coffee intake to about 1 or 2 cups in a day. Then the seventh question, it says, I want to know what are called gallstones. I've heard a lot about gallstones. In view of this, I would appreciate it if you can let me know what gallstones are about. And my answer is that gallstones are stones or lumps that develop in the gallbladder or the system or the bile duct where certain substances adding together. People with gallstones may not experience symptoms until the gallstones become increase in size and they can inflame the gallbladder. So this primary symptom of an enlarged gallstone is pain. It can come on suddenly and can get worse. And this pain can occur on the right side of the body, just below the ribs, between the shoulder blades. Other symptoms that can also occur include nausea, vomiting, sweating, and restlessness. And it's been confirmed that the kind of chemical that form the stone is very important. If the kind of substance that form the stone is something that is small, like cholesterol, that one can be dissolved with some tablets. And that one is not difficult to treat. However, when the gallstone is big and difficult to treat, you may need surgery, where the doctor excuse me, The doctor may have to operate you under a general anesthesia, and also you can use some ultrasonic shock waves to break up gallstones. If gallstones become small enough, they can pass safely when you drink a lot of fluid. Therefore, people with gallstones should eat a balanced diet with regular meals. Although this will not cure gallstones, but it can have a positive impact. It will reduce the pain and symptoms. It's also important for you to reduce food that are high in fats, like butter, cheese, cakes, and cookies, to reduce your gallstones. And cholesterol intake too from excess meat and excess egg should also be avoided. And the last question in this series, the 8th question, is again about Alzheimer's disease. He says he wants to know whether Alzheimer's disease is reversible. He said, my elderly aunt, who was recently diagnosed with Alzheimer's disease, is currently on medication. Can you let me know if the disease is reversible? Then my answer is that it's been confirmed that people that have Alzheimer's and sometimes other issues of memory loss they can get better. There are some medications that can slow down the progress of Alzheimer's in some people for a while. It can even improve their condition, improve the quality of life. However, as of now, there is no drug yet that can eradicate the disease. Nothing that will cure the disease. But there are drugs that can help whoever has Alzheimer's disease to have improvement in his life. And also some changes in lifestyle, like increment in socialization, regular exercises, learning new skills or games, or taking part in some activities like sports can also help somebody with Alzheimer's disease to live a normal life. And on this note, we come to the end of another episode of Ask the Doctor. I'm Dr. Wale Okedino, a family health physician of 45 years in practice. We'll see you again during the next episode. Thank you.